Hi folks, good morning everybody. Today is a World International Disability Day. So this day I just wanted to speak some few words about low back pain, chronic low back disability. So I have read a recent one article on cognitive functional therapy on chronic low back pain for a female patient 36 years old with low modic changes with grade type 1. So this was actually written 5 years back. It was a Denmark article, have been organized and written in Curtin University by Peter Sullivan and his team of friends. So it's a wonderful article. Just wanted to show some awareness to this chronic back pain population peoples. So the a metaphor for that, a female patient with 36 years having a severe back pain for the past 6 months, and she is having a pain over the right side loin and gluteal region, and for the past 6 months she has traveled elsewhere, had seen so many doctors, physios and different alternative medicines. She has been tried, finally got frustrated, and finally she consulted this cognitive functional therapy Peter Sullivan team, and she was assessed and find out some of the modic type 2 changes structures which causes severe psychological impact on the mind. So automatically her cognitive factors like fear, anxiety, distress, frustration, affecting factors like fear avoidance behavior, not putting weight on the right side, not going for forward bending. I just asked her to do some lifting activities, like she used to pop up her hand with left hand on the left side, putting overweight on the left side, not putting the weight on the right, and just by lifting the leg, and she is doing a down floor lifting activities. So she is having a fear because of some structural damages may happen, and anxiety and distress, some psychological instincts or more. So what will happen, this provokes more and more protective muscle sensitizations over the L5S1 regions, specifically the part which gets sensitized. So all these things which has been assessed by Peter Sullivan, so complete sensitizations has been assessed, and her SLR is 90 degrees, both right left, as well as EHL is normal, but she is having only, the problem is this cognitive and affective factors. That is the main important implication here. So immediately after asking all the histories, he found out what is the short term and long term goal of the female. So short term goal is she wanted to do household activities, wanted to play with her child, male boy, and wanted to do all the gardening works. And long term goal is she wanted to do exercise, cycling, walking, like that for her physical activity. So her social factors he assessed. She is a divorced lady and she is living with her only one male boy. So that is her family situations and having a financial stress also. So finally she was assessed, and finally he has given an education tool called as making sense of pain. So what is the problem behind in this female patient? She is having a pain which is mainly having a negative belief, distress, frustrations, leading to fear of that structural damage which has been happened. It is only a disc degeneration and modic changes only. There is no severe problem in the spine. So the structural pathology and her problem is not correlated, and he explained clearly the education. And next is, because of this, she is completely avoiding the putting weight and avoiding a forward bending movements. So movement, provocative behavior which is present and which reduces her physical activity, becomes more and more disabled and frustrated, finally having catastrophizing and kinesiophobia, leads to disability. So this is the pathway of her disability. So what is his plan? His plan is giving appropriate education. Don't get fear. just give a positive belief and nothing worry about the structural pathologies. So it's completely not a problem at all. It is not correlated with your pain and other things, so don't worry. And ask her to relax the spine by me giving different exercises. Like she's not able to put the weight or she's not able to forward because she's doing a protective guarding of the abdominal part as well as the back, which is she's having a stiff. So ask her to relax the spine by doing deep breathing exercises, and gradually ask her to put the weight on the right side and ask her to lift the weight on the floor. So gradual implications, this is called as a graded exposure to the movements. So exposure to the pain control movements, first giving a little amount of the weight shift to the right and gradually it has been increased. So the little amount of the weight which has been given, the pain will become from 10 centimeter to 5 centimeter and from visual analog scale, and gradually this has been written to 3 centimeters and tolerance will be developed. So her negative belief become positive belief, her fear is reduced, her catastrophizing scale is decreased, kinesiophobia scale is decreased, and her physical activity level will be improved. So short term goal, ask her to do little bit activities of household and ask her to play games with the children like football or shuttlecock or whatever the thing may be, but graded manner with the children, as well as her long term goal, ask her to sit in the bike, relax her pelvis and spine, and in order to prevent the protective guarding of the abdominal muscles, ask her to relax sitting and do the exercise biking activities. So this is a pattern of doing a cognitive functional therapy. Highly it has been taking as a challengeable of modifiable factors. So what are all those modifiable factors, as we know very well about this negative belief, fear, frustration, and which leads to distress and disability. So this has been pointed out, this has been taken out, easily can be modified. So this is an important thing he concluded in this study. So not to worry about for the structural problems. So this will implicate the problems over her brain in the limbic system, her pain drive, her fearness drive or more, so which causes a fight flight hormones to secrete more. So he explained very clearly. So education is a valuable tool to start we can give in the subacute or acute stages in order to prevent the chronicity of the low back pain. So this message is very, very important for this day of Disability International Day. Hope this will be a very useful message for all. So thanks for keep watching patiently and please feedback me. Thank you.